Hi, my name's Anna Wallwork. I'm a physiotherapist here at Advanced Rehab Centre. This client tutorial is on spasticity, what it is, how it can change, and how to manage it. Your medical team may have mentioned that you have spasticity or a muscle with spasticity. This is a common symptom we see in people who have a neurological condition, such as after stroke, spinal cord injury, cerebral palsy, MS, traumatic brain injury, and HSP, to name a few. Spasticity is when a muscle has altered high tone so that the resting activity of a muscle is increased, which can then lead to tightness of the muscle. It is caused because the brain signals which control the tone are interrupted, either within the brain itself or the spinal cord. This leads to hypersensitivity of something called the stretch reflex. Spasticity can change over time and often goes hand in hand with weakness. Spasticity can lead to painful postures, spasms, difficulty standing and walking, or completing normal daily activities such as releasing a cup with your hand. In my experience, the muscles I would most commonly see spasticity in are the calf muscles, the hamstrings behind your knee, the pectoral muscles in your chest, and muscles of the forearm and hand. Spasticity can be in just a single muscle, or it can be generalized, and this affects the type of medical treatment you may receive. There is a large range of spasticity severity. Management might be to maintain hygiene, such as being able to open your hand to clean it, or it might be management so that you're able to return to running. It is important to note that there are issues that can increase spasticity rapidly, such as being unwell with an infection, like a urinary tract infection, having an ingrown toenail, constipation, a pressure area, or a poorly fitting brace or a wheelchair. This can lead to a cycle where the spasticity is heightened and can reduce your everyday function and increase pain, which then can increase spasticity further. This is why it's really important to monitor your spasticity closely. How will you know if your spasticity is getting worse? Well, you might find that you start to develop pain around a particular joint or muscle. You might find yourself tripping up more often, or that your heel is not coming down to the ground when you're standing up. You might find yourself struggling to open your hand to release objects, or that you're getting more spasms than usual. The good news is that there are several ways of managing your spasticity through therapy. A multidisciplinary approach is optimal. Medical management from your neurologist includes use of medications such as baclofen, Botox injections, or occasionally surgery is required. Therapy pre and post Botox is really important to ensure that the Botox is as beneficial as it can be. Along with medical management, there are several options including, but not limited to, strengthening the weak muscles, seating and posture reviews, active stretching of the tight muscles, weight bearing through the limbs, electrical stimulation of weak muscles, casting, which is making splints or serial casts to improve range of movement, correctly fitting your orthotics and shoes, and treadmill training. We are also having some promising results from use of our Armadeo machine, where we're finding that after an hour session, our clients have increased muscle activity and reduced spasticity in their hands. If you do notice your spasticity is increasing, you or a carer can check whether there is an area of pressure forming, or whether your seating, splints, or shoes are not fitting so well. It is then best to get this checked by a professional to help fix these issues. It is also important to touch base with your doctor or neurologist to check why this may be happening, especially if there is no external source found, as you may have an infection. Your physiotherapist can also help by giving you therapy options to help manage this. The key points from this tutorial are that spasticity is a long-term condition. It can change over time. Management of your spasticity is important and it needs to be closely monitored. Your ARC therapist can help, both with active therapy to help manage this spasticity and with advocation to your medical team for more medical management. We have a multidisciplinary team, including neurological specialist physios, occupational therapists, exercise physiologists, and an orthotist. Please get in touch if you think we can help.